Warm welcome to the latest CardioShorts podcast, brought to you by MedSynapse. CardioShorts covers a wide range of clinical and scientific medical content that offers enriching insights into the world of cardiology. In today's episode, we will be discussing the study, titled Amyloid Deposits and Fibrosis on Left Ventricular Endomyocardial Biopsy Correlate with Extracellular Volume in Cardiac Amyloidosis, published in the Journal of the American Heart Association in October 2021. The study evaluated the contribution of amyloid and fibrosis to extracellular volume expansion in cardiac amyloidosis. Amyloidosis is characterized by the extracellular deposition of amyloidogenic proteins in a beta sheet structure, with a typical green birefringence by Congo red staining on polarized light microscopy. Immunoglobulin light chain and transthyretin amyloidosis are those associated with the most clinically relevant forms of amyloid cardiac disease. Amyloid deposition may cause tissue disruption and dysfunction, organ failure, and death, and hence, accurate diagnosis of cardiac amyloidosis and characterization is necessary. Endomyocardial biopsy remains the gold standard to assess the details of cardiac amyloidosis, along with non-invasive imaging techniques, such as cardiac magnetic resonance. However, with the diagnostic techniques available, the fibrosis in the extracellular volume expansion in cardiac amyloidosis has never been defined. The stated study included patients with endomyocardial biopsy-proven diagnosis of immunoglobulin light chain and transthyretin amyloidosis. For the endomyocardial biopsy, a semi-quantitative histology score was assigned to each sample to consider the amyloid deposition, fibrosis extent, and the inflammatory infiltration, as either amyloid deposition or fibrosis extent. Patients underwent late gadolinium enhancement imaging, or LGE, for the imaging of the left ventricle. 5 left ventricle regions were considered: anterior segments, septal segments, inferior segments, lateral segments, and apical segments. The LGE pattern was classified as 0 for absent, 1 for patchy, 2 for subendocardial, and 3 for transmural. Global LGE score was obtained by summing the 5 regional scores. Among the patients included in the study, lambda-positive light chain amyloidosis was found in 14 of the 19 cases, and kappa-positive light chain amyloidosis was found in 5 of the 19 cases. Transthyretin was detected in 18 cases. Amyloid deposits accounted for 15% of the tissue sample area, without a significant difference between the light chain and transthyretin amyloidosis. All patients displayed myocardial fibrosis, with a median extent of 15% of tissue samples, in the absence of spatial overlap with amyloid deposits. Interstitial fibrosis was often associated with mild and focal subendocardial fibrosis. In 20 patients with myocardial T1 mapping at cardiac magnetic resonance, the combined amyloid and fibrosis extent displayed a modest correlation with extracellular volume. The sum of amyloid and fibrosis displayed an even closer correlation with extracellular volume in patients with transthyretin. The study successfully reported the presence of fibrotic tissue in the extracellular volume, in addition to amyloid deposit to a significant extent. However, the reason behind fibrosis with cardiac amyloidosis is unknown. Cardiac fibroblasts internalize aggregated transthyretin in vitro, and matrix metalloproteinases are overexpressed in cardiac amyloidosis. Cardiac magnetic resonance studies have also documented amyloid deposition in the perivascular and vascular spaces, expanded extracellular spaces, and capillary rarefaction. These mechanisms could be attributed to fibrosis in cases of cardiac amyloidosis. The study results also demonstrated the different patterns of amyloid deposits, including diffuse or nodular, and within perivascular and interstitial spaces. Hence, the expansion of extracellular spaces due to fibrosis, as observed in left ventricle endomyocardial biopsies, could help in myocardial tissue characterization at cardiac magnetic resonance imaging. This concludes our today's CardioShorts podcast, brought to you by MedSynapse. Thank you for listening.